Okay, Chairman, we're now live and we can commence the meeting. Thank you.
Thank you very much, Liz. Good evening, everybody, and welcome to the virtual meeting of the Social Care, Housing and Public Health Overview Committee. This is a virtual meeting. It is also being broadcast simultaneously on the Council's YouTube channel. My name is Councillor Ian Edwards and I am Chairman of this meeting. The terms of reference for the committee are published in the papers. And for those present during the meeting and intending to speak, please note that you will be filmed and any statements that you make will be recorded and made public. Now, because it's a virtual meeting, and actually I'm at a slight disadvantage in that I cannot see everybody who's present. The screen only shows a limited number of people. It is difficult to chair in these circumstances. So there are a few additional housekeeping rules. First of all, can we please make sure that mobile phones are silent? If you're wearing a headset, ensure your microphone is away from your mouth to avoid noise. And please keep your microphone muted when not speaking. Only one person may speak at a time, and I, as a chairman, assisted by Elizabeth Penny, our clerk, will do our level best to call those to speak. I just will add on to a tiny other little bit, because I cannot see everybody and therefore I cannot see a hand raise or an indication visually that you wish to speak. I remind everybody that there is a chat function. You can quite easily type your name in and just indicate that you wish to speak, and I'll pick it up that way to make sure that we include everybody. Right, now because it's virtual, because we can't see everybody, we need to take a roll call. And when I call your name, would you please answer to state your presence? Councillor Makwana.
Yes, I'm present. Good evening.
Thank you. Councillor Cooper.
Yes, I'm present. Thank you.
Thank you. Councillor DeVille.
Yes, I'm present.
Thank you. Councillor Eddington.
Good evening, I'm present.
Thank you. Councillor Garner.
Yes, I'm present.
Thank you. Councillor Rodriguez.
Good evening, I'm present.
Thank you. Councillor Tuckwell.
Good evening, Mr. Chairman. I'm present.
Thank you very much. And we are also assisted this evening by officers of the council, and I will introduce them and they will declare their attendance. Gemma McNamara.
Good evening, I'm present.
Thank you. Kate Kelly-Talbot.
I'm present.
Alex Coman.
Present, good evening.
Good evening. Claire Soley.
Good evening, I'm present.
Ian Anderson.
Chairman, Ian Anderson will be joining us a little bit later. He's going to be joining at about 7:30.
That's fine. Thank you very much. And Liz Penny.
Yes, I'm present. Thank you.
Okay, now in terms of the technical meeting, control of it, if a
sorry, Councillor Hagar is indicating.
Sorry.
Councillor Hagar, were you not mentioned? Apologies.
Yeah, I'm present and I'm here, Chair. So good evening.
My apologies if I omitted you. I believed I had gone down the list. My apologies to you.
Okay.
That confirms that the full committee are here and also a number of officers. Okay, as I was saying, in terms of the control of the meeting, if for any reason the councillor leaves the virtual meeting, potentially through a loss of connection, for example, we will continue with the meeting unless we are not quorum. And the quorum for tonight is 5 councillors. Importantly, any councillor who does leave the meeting for a period of time would not be able to vote on the item that they were not present on, although I don't think that is an issue this evening. Details of the business to be considered today is shown on the agenda, copies of which are available on the YouTube but underneath the broadcast. And we are now going to move to agenda item 1 and proceed with the meeting. Let me just now turn over the pack, and this is apologies for absence, which we've already sorted. Any additional declarations of interest, please? I see none. Do you see any at all, Liz?
No, there are none.
Okay, no additional. We're moving to item 3, which is to receive the minutes of the previous meeting dated the 6th of February. Are they agreed? In the absence of dissent, I will take it as agreement. Are there any dissenters? No dissenters noted. And also the minutes of the 14th of May. Are there any dissenters to the accuracy of those minutes? I see no indication to the contrary, therefore they are marked as agreed. This is to confirm that items of business marked as part 1 will be considered in public. There are no items of part 2. We will now turn to agenda item 5, the 2020-21 budget planning report for services within the remit.
So, Chair.
Yes, Councillor Edwards.
So, could I just point out that previously we did talk about including the corporate parenting panel minutes in part 2. I realise that in this case there's nothing which would be referenced to an individual, but we do have a co-chair of that panel who isn't actually identified on here, but could be if in future the minutes of the panel were put in part 2. So it's just a thought for future.
Thank you very much, Councillor. Your representation was well made last time and has been properly considered by Democratic Services. And my understanding is they can only withhold the minutes if there are reasons within those minutes themselves to withhold them. They cannot give a blanket ruling. And as you correctly pointed out, there is nothing within the minutes today that cannot be disclosed. Therefore, my belief is that they should be disclosed in part 1. I am assured that they are reviewed on each occasion to confirm their appropriateness to be within part 1 rather than part 2. I hope that answers your question. Okay. Agenda item 5, please, the budget planning report for our services. Thank you. Who's asking for that? Is that?
It's me, it's Gemma McNamara.
Thank you, Gemma. Thank you very much. Over to you.
Thank you, Chairman. Good evening, councillors. So this represents the first of 2 opportunities for policy overview committees to discuss the current stage of development of budget planning work within the remit of social care, housing and public health. The second opportunity will come in January, where the detailed MTFF proposals will be reviewed. As detailed in the report, the budget gap and savings requirement for the 2 years up until 22-23 stands at 19.987 million. This includes a council tax increase of 3.8%, and which is made up of a core increase of 1.8% and a 2% social care precept as in current year. Table 1 within the report details how this gap has been arrived at, with an underlying savings requirement of 24 million, driven by inflationary pressures, capital financing costs and service pressures. A further 6.3 million of savings has been deferred from earlier years and through the use of reserves, and is then added to the position. This is then netted down by 9.7 million of council tax increases and a further 1 million of previously put forward savings. The inflation requirement is driven by a workforce inflation of the annual pay award of 2%, with a further 0.5% per annum increase in employers' pension contributions estimated. A further 4.8 million increase on the cost of care provision is included to keep pace with growth of the London living wage, and the remaining 1.7 million of that inflationary pressure relates to contracted expenditure. The current capital programme includes 165 million of capital investment without specific financing strategy, which is driving a growth requirement of approximately 5.5 million in debt financing and repayment costs over that 2-year period. And the calculation is generally that every £10 million of capital investment requires approximately 575k of revenue support to fund that borrowing. The increasing demand for services linked to demographic changes accounts for 6.9 million, reflecting a continuation of current trends across waste disposal, adult social care, SEN transport and children's social care. In relation to COVID, as is detailed in the report, general fund pressures of 25 million are projected in relation to COVID and are being reported on a monthly basis to MHCLG. Grant towards this of 15.6 million has been confirmed, with a further 8.5 million expected from the recent third tranche announcement relating to lost income. It is expected that these funding allocations, along with the use of earmarked reserves, will contain this exceptional pressure this year. At the end of, as part of the outturn of 2019-20, the council also earmarked additional £3.3 million to fund any COVID pressures that were to be arising. In addition to this, we have a £2.4 million public health reserve, which could be directed towards COVID if required. General balances currently stand at 28.26 million at the 31st of March 2021, reflecting a higher than budgeted pay award for the current year. Within the MTFF, there is inevitably a higher level of uncertainty than usual, with both the spending review and the review of business rate retention policy delayed, not to mention the impact of the COVID pandemic. However, the Council is well placed to deal with this challenge with a solid track record of delivering balanced budgets and delivering ambitious savings programmes. In terms of the next steps, the MTFF report will be considered by Cabinet in December 2020 and will be consulted on during December and January, at which point I will return with a further report for your consideration at that time. I should be happy to answer any questions if there are any.
Thank you so very much, Gemma. I see Tony Eggington indicating. Are there anybody else that wish to ask questions on this one? I don't see anybody else. Tony, Councillor Eggington, please go ahead. Thank you,
Chair. I understand that the pay award for council staff is 2.75% as opposed to the 2% which has been provided in the budget. How will that affect the figures? That's the first question. The second is that the level of savings required this coming year and in the following year is about 150%. That's 50% up on the current year. And to me, it looks as though all of the relatively easy savings have been achieved over the last 4 or 5 years, and it's been a struggle to get the savings over the last couple of years. Is it going to be easy? Is it going to be possible to achieve the proposed savings in the next 2 years without making some frontline service cuts?
Thank you, Councillor. In terms of the pay award for the current year, you're absolutely right. It is at a higher level than the 2% that was budgeted. Currently, the 0.75% has been built into the budget for next year. And in the current year, we're managing to contain it within existing resources. So there's no additional pressure that's coming through. With regard to the level of saving... Oh, sorry.
Gemma, if I can come across here. My understanding is that the purpose of this paper is to set the strategic context in which you will be presenting the actual finance, the budget for the services relevant to our scrutiny. Absolutely. The actual issue of the strategic context, I think, is a matter for challenge elsewhere. That is considered in Cabinet, that is considered at Council, and I would prefer not to go into detail within this committee about the underlying makeup, the context, the Council's wider finances. That is for us to note at this stage, and that is what we're invited to do. So I would prefer, Councillor Eggington, if that is a matter that you wish to pursue, you pursue it through Cabinet. Okay?
Could I just...
Yes, if you wish to come back, please.
I wasn't asking for specific details. All I was asking was whether it would be possible to achieve the savings without making without affecting frontline services. It was a general point rather than anything else, and strategic.
Yeah, my point is that possibly a finance officer is not the best person to answer that one. That is a matter for the Cabinet to determine the feasibility and the reasonableness of it. I'm sure that officers will diligently carry out the task directed of them of Cabinet. So I would rather not put our finance officers in that difficult position of saying whether or not something that the Cabinet may decide to do is realistic and achievable, because they will deliver what is required. As I say, if you wish to challenge the reasonableness of the savings targets, that is a matter to be pursued within Cabinet and not within this committee. This is just for us to note the strategic context in which we will consider the detail of the financing of the departments for which we scrutinise. Okay? Are there any other questions, please, for Gemma at all on the finance paper? There being none, thank you so very much. We will move on, please, to agenda.
Thank you, Chairman.
And at this stage, Gemma, you are under no obligation to remain as you have completed your input to the meeting, okay?
Thank you so much. Have a good evening.
Thank you very much, and good evening to you. So we're now turning to the Hillingdon Safeguarding Partnership Annual Report. And we have Alex Coleman and Claire Soley are presenting on this one. Thank you.
Thank you, Chair. Good evening, councillors. So Alex and I are delighted to present the 2019-20 Safeguarding Partnership Annual Report to you this evening. This is the partnership's first report under our new arrangements, and it is important to note that it's the final draft version, which is still awaiting validation from the Safeguarding Partnership's Executive Leadership Group, which is due to meet at the end of October. Everyone has a right to live free from abuse and neglect. And last year, we had a really sharp focus on reviewing our local safeguarding arrangements to strengthen collaborative working between children and adult safeguarding, and also, really importantly, with other strategic forums in the borough. And you'll all be aware and involved in a number of those. This meant we had to revise how we worked and set ambitious strategic objectives to optimise the safety, well-being and quality of life of all Hillingdon's residents across all age groups. The outcome of the work was the development of what we've called our Hillingdon Safeguarding Partnership. And I truly believe that the development of this partnership over the past year has enabled our really ambitious vision to become a reality. So some of the changes were required due to some changes in safeguarding children's arrangements, and these were updated in accordance with legislative changes embedded in the Children and Social Work Act 2017, and also a piece of statutory guidance called Working Together to Safeguard Children 2018. These changes introduced a new partnership where the local authority, the local clinical commissioning group and the police share equal responsibility in safeguarding vulnerable children. And I think you'll agree that this shared and equal responsibility is exactly how it should be. So the changes in the children's safeguarding arrangements provided a real opportunity for us to review our safeguarding adult arrangements. And while the CARE Act 2014 provides us with the legal framework for safeguarding adults boards, it gives us some movement around how we can interpret that locally. And that's what we've done here in Hillingdon. And last year, we created this partnership, and we're really striving to be pioneers in our collaborative safeguarding arrangements. So essentially, the two areas that cover and are responsible for setting strategic objectives and our ambitious plans are the Children's Partnership, which was previously the Children's Safeguarding Board, and the name remains the same for the Safeguarding Adult Board. So the report that we've presented this evening provides details of the work complete by both these boards, covering the financial year 2019-20, so last year, and includes the framework for the new partnership and the structure of that as well. The reason that we've presented the report to you this evening is to provide the board with reassurance that our multi-agency response to safeguarding in the borough is robust and is effective in optimising the safety of all our residents. Alex and I are happy to take any comments, and we will take the report as read. However, I think it's really important to highlight some key areas, both for adults and for children. I'd like to start by recognising that while this is a collaborative approach, there are still distinct areas of work and separate legal frameworks for children and adults. And it's really important that we do recognise that. However, there are points that we recognise should be shared objectives moving forward. So we've got a number of areas where there is a collaborative shared approach. Those are namely the Modern Day Slavery subgroup, our Practice Development Forum, which is a forum that uses learning from statutory reviews and any other type of review to improve practice, and a Serious Case Panel, which is a panel that receives referrals where we need to consider the need for a safeguarding adult review or a child review into a case where there's learning lessons to be learned. So some of the highlights for adults. So we strive to minimise the occurrence and impact of all types of risk of abuse, neglect and self-neglect. And we used local data to inform our key priorities last year. And these were financial abuse, modern day slavery and domestic abuse. But moreover, we recognise that the views of individuals at risk of experiencing abuse, neglect and self-neglect must be central at all times. And if we're not getting that correct, we're not doing something right. As a result, we've commenced an ambitious action plan related to what we call making safeguarding personal. And essentially that's a fancy title for making sure that the adults' views are absolutely central to anything that happens. So we work towards what we call the adults' outcomes, what it is they want to happen in their life. They are the expert in what is happening. In 84% of our cases, so the cases that we made inquiries in terms of safeguarding, 84% of the individuals were asked what they wanted to achieve, and that's something to be celebrated. Now you might ask, well, that's 16% that weren't asked what they wanted to achieve. And unfortunately, there are times when it is not possible to ascertain the wishes of the adult. And one of those really difficult situations is where tragically the adult has passed away. When individuals were asked what they wanted to happen, in 94% of the situations we were involved in, outcomes were fully or partially achieved. So again, that's a real achievement for our partnership. Moreover, in 95% of cases, an advocate, a family or a friend supported the adult to express their views. So these are some real areas for us to celebrate. It's important to recognise that the total number of safeguarding adult concerns received into the local authority, who are the lead agency for safeguarding adults, they increased by 20% this year compared to last year. We see that as a good thing. It means that there is more awareness of safeguarding adults. People are talking about it, they're recognising when things are not right, and they're referring it into the local authority. We've got some quotes in the report from adults who have worked with us around safeguarding adults, and I thought it was really important and poignant to highlight those. One adult said, "I am safe now. Hillingdon did a good job." Another adult said, "We are feeling safer now and our family are helping to look after us. I am happy that staff were checking on us and we now feel safer. Everything seems much better now." I would also like to draw your attention to section 6.7 of the report, and this outlines the work of our provider risk panel and our care governance procedures. The purpose of these two groups is to optimise the quality of the care and support delivered from our providers within the borough. So domiciliary care providers, day opportunities, care homes and other establishments within the borough. And the work outlined in the report demonstrates that there's a real joined up approach to support these providers to deliver the absolute best quality and excellent care that they can. I would also like to draw your attention to section 6.8. This recognises the high performing deprivation of liberty safeguard team that we have in the borough. This team is to be celebrated and works effectively and is recognised across London as an exemplar of excellent practice, which is to be shared nationally also. So it's nationally recognised as an area of excellent practice. Another area that we've worked very closely with this year is understanding our relationship with the police. And I know last year the committee was interested in how many cases were involved the police and what the outcomes were. So we've got a much better, robust data set to help us move that forward. And we're monitoring cases to make sure that victims do have access to justice. And that's something that we're continuing to develop with. Things always can improve, and areas for us to work on this year are to strengthen the voice of the adult, and I've already mentioned our ambitious plan around that and making safeguarding personal. We want to introduce the voice of the adult and lay members onto our Safeguarding Adult Board strategic objectives and work plan, and actually move towards having lay members and adults on the board and making sure that whatever we're doing is the right thing for them. We're also commencing and already have commenced our work around our adult MASH. And this is a multi-agency safeguarding hub which will sit alongside the existing children's MASH to strengthen our approach across the borough in responding to safeguarding concerns. This would also link with possible developments around a domestic abuse one front door and with CNWL's single point of access, which is around prevention and delaying of care and support needs, and making sure people get the right support at the right time. I'd like to pass over to my colleague Alex now to provide some highlights for children's. Thank you.
Thank you very much, Claire. Thank you, Chairman. Good evening, everyone. Thank you very much for that great introduction, and I think it's a good demonstration of this strength and working together between children and adults when a colleague from adult social care introduces the work of children's social care so well and so comprehensively. So thank you for that, Claire. In terms of children, you will see in the report there are contributions for various partners who contributed this year and the last financial year to the success of the partnership, and I want to extend my thanks to all the colleagues who contributed to this report and all the other agencies who invested a lot of work and a lot of dedication and commitment to making the children in Hillingdon safe and to continue to provide high level of services. Some of the priorities that the children partnership, safeguarding partnership has focused on during the last financial year were things like protection of the children who are at risk of contextual safeguarding, and that was achieved to the strategic high risk panel and various other kind of subgroups that are reporting into that forum. Very important was the focus on neglect, which led to various trainings and various audit functions and various learning events that will continue in this year. Also, what I would like to re-emphasize from what Claire was said was the kind of the great achievement of the two services this year are actually coming together and having a coherent way of identifying needs, identifying risk, and identifying a joint operating model across children and adults, and also recognizing that some issues like modern slavery or exploitation are common to residents of all ages. So coming together to have a coherent strategy across all ages, I think makes perfect sense, and it will lead to much better outcomes. The other key area of the safeguarding partnership in children and in adults is focused around learning. It's focused around learning from our practice, learning from good practice, learning from things that we could do even better, and learning from what other people in other parts of the country are finding, various serious case reviews, researches, and various other kind of national audit programs. And that was really helpful in terms of the partnership, to always keep an eye out there, to learn from good practice and to embed that in our experience. And again, that was done through our practice development forum and through our serious case panel, was done across children and adult services. Just to highlight, I mean, there is a lot of information in the report. But I will just want to highlight a couple of things that kind of show the dedication of the partnership in embedding a relationship-based practice and working better with families, working in collaboration with our children and young people. And I would want to start by highlighting the amazing work that our adolescents team has done, and they've started working in a very innovative, a very different way with adolescents and with young people who are at significant risk of contextual safeguarding, exploitation, and various other criminal activities and criminal exploitation. So the way in which they engage with young people and the way in which they support them along, kind of every step of the way, have been recognized regionally and nationally through various national awards and to various forums and various events that took place. But also in January of 2020, the Children's Services and the partnership were scrutinized by the Ofsted, or during a focus visit that took place in January, and the report was published in February of this year. It's self-explanatory in terms of the good and amazing outcomes that our team and our children are achieving. Speaking about relationship-based practice and speaking about engagement of children and young people, I wanted to emphasize that we are encouraging all our children and young people to participate in their meetings, to participate in meetings that have meaning to them, meetings where we decide and we discuss plans that are impacting on their life. And it's really reassuring to see that during this year, out of all the children who are looked after over the age of 4, more than 300 have actually participated in various meetings, and it's of note that the participation is not always face-to-face participation. Sometimes they choose to participate by phone, choose to participate by video, or by an advocate or in writing. So all those various ways of participating are encouraged and are offered and available to our young people. And so the good working together between the agencies, the good working together between professionals and families and children led to a much better placement stability for our children. They're stable in their placements. They remain with the same carers for longer, which has obvious benefits in terms of their stability and their outcomes. And just to highlight a few of other things that the children in Hillingdon have achieved, I wanted to mention the Children in Care Council, alongside various partners, are delivering a training that's called Walking in Our Shoes. Now, I would invite anyone from this panel to subscribe to that training and to be part of it, because it's something else. It's been written by children, it's delivered by children, and they talk about their experience of being in care, they talk about the experience of receiving services, and they tell us first person how it feels to be at the receiving end of services and what good looks like. And that's the sort of training that I think we, any profession working with children would appreciate. So in the last financial year, they delivered the training face to face. That was pre-COVID. Delivered the training face to face to 87 professionals from various agencies, and some of the feedback is included in the report, and you'll see it's overly positive. And the same group of young people, our Children in Care Council, have also got the award for the best community group as part of the Inspire the House Awards. So they've been awarded. They received their award in the House of Commons, and that was a really great recognition of the contribution of and the dedication to promote the voice of the children, voice of care leavers. And then also I just wanted to mention across the partnership the success of the Troubled Families program, which continue to deliver for the 5th year running. Very above national average successes in turning around family and achieving meaningful change for various families and children and young people. So I think I think we both, Claire and I, are ready to take any questions without going into any more detail. So thank you very much.
Thank you very much. I've noticed Councillor Gardner and Councillor Hagger. First of all, and Councillor Eggington, first of all, I would just like to say thank you to Claire and Alex there for your presentations, and also just to comment on the completeness of the report and how much information it has given me and reassurance that it's given me that all of the partnership are taking really big steps in coming together and delivering the framework to ensure that residents, both old and young, are safeguarded, and I'm grateful for that. So let's turn first to the questions. Councillor Gardner, please.
Yeah, I'm quite impressed with the report, bearing in mind that the years I've sat on this council and how things change, they've got better. Can I get some sort of reassurance? I've seen the bit about domestic abuse for adults. Can I get some reassurance that the children of domestic abuse victims are treated as a priority, and then they need safeguarding, they also need protection? I'm quite worried about people don't regard the children as being victims themselves, but they are. They see and they hear things and they're troubled by it. So can you give me some sort of reassurance that we will be picking up and keeping an eye on them and talking to them? I talk to the children sometimes at domestic abuse victims, and they tell me what they've heard and what they've seen, but they don't want to share it with their parents or their mum generally. So can you give me some reassurance on that, please?
Alex, can I hand that one to you, please?
Thank you, Chairman. Thank you, Councillor Gardner. Absolutely, I can definitely reassure that in terms of our scrutiny of the information received at the front door, at the front of the house in MASH, which is, again, it's a multi-agency forum that's attended by the police, by colleagues from health, by ITVA colleagues as well, the Independent Domestic Violence Abuse Service. They are considering a whole family approach, and they are looking not just at one member of the family. There's always consideration specifically about the children and the impact that various forms of abuse have on children. Domestic abuse is definitely at the top of the agenda for children's services. It's recognized as being an issue that needs to always be considered, and we are looking at how the victims are supported, but primarily about the children, the impact on the children, and making sure that the children are kept safe. In the report provided, there is a section that talks about the successes of our Independent Domestic Violence Abuse Service, the ITVA service, which continue to grow from strength to strength in supporting victims, supporting children, and working in very close partnership with the other parts of the children's services and the other parts of the partnership. And I would also want to draw your attention in the ITVA section at the success of the initiative that placed an ITVA colleague in Hillingdon Hospital to increase the awareness of the hospital colleagues about the impact of domestic abuse, and to be able to pick up the information about domestic abuse at the point of at point of referral in hospital. And this led during the financial year to an increase of number of referrals picked up by ITVA around domestic abuse from 51 the year before to 129. So that is more than double the number of referrals that were received, which in my view, I think that is a positive development, and we're addressing the issue of domestic abuse. Thank you.
Just needing to unmute myself. Councillor Gardner, do you have a supplementary to that at all?
Well, basically, is what my thing is DV, but I always think that children must be considered. They've got to be, because what they see and what they hear, and people often don't think that it affects the children, but it does.
I couldn't. Apologies, if I may.
Alex, I think we've answered that question.
Thank you.
Previous statement of the previous statement. So if we may, please, we'll go to Councillor Hagger.
Thank you, Chair. A very good report, and I think this is the first time I sat on the panel for a number of years. This is the first time I've seen such an in-depth report, so I'd like to congratulate officers on the work, and it really is shown in here. That's the first thing. The report, my only concerns are I put it in a paper format, and I couldn't quite see the shading colours and the shading as what's what. So I don't know whether we can clarify that a bit more, Chair. Things like on page 42 and 43, I wasn't sure on the safeguarding adult concerns versus inquiries, which one was the concern and the inquiry. I mean, I get that the higher one might be the inquiry and the smaller one might be the concern. Is that correct? I just wanted to, I'm sure it is, but I also wanted to cover a little bit. It's good to see figures, so thank you very much for the figures. That's the first time we've actually had figures on a report, so I'm really pleased with that. What I did, there was just two questions that I wanted to ask. One, whilst going through the report, I've noticed all the work that we have done is amazing. I was very interested to see whether there's anything about the COVID at the moment. So the work that obviously we're doing now through COVID, and bearing in mind that many of the healthcare professionals and the agencies that we're using might well be restricted on their access. So one is there anything we're putting in place now for that? Like if a resident had to log a concern, how would they do it? I mean, I've been on the website and we can't, it's only loaded for professionals, the form, not for residents. So I wondered whether I know we wouldn't normally, but I'm wondering whether we can tailor that a bit just for COVID. That was my first question. And my second question was, I noticed that some of the staff training has been stopped due to COVID, and I wondered whether we could pick that up and do online training. I noticed that although COVID is in action, it's a great time where people are probably more susceptible to do online training. So two questions there. Thank you, Chair.
Thank you. Before I invite Claire to answer maybe those questions, I would just like to say that in absolute fairness to the officers presenting the report was exceedingly clear in the different charts. That is down to the process by which they are published and is outside the control of officers. I did have to go online myself to look at the actual reports as saved online, and it is something that again we need to feed back into democratic services, that when they publish reports that include charts, they need to give consideration to the transparency of the information being presented, particularly when every chart is in grey. It is very, very difficult to understand what we're saying. So that point is well made. It is being fed back into democratic services, but is not an issue for the officers themselves because their charts were beautifully coloured, easily interpreted. So Claire, can I pass to you the questions about during the COVID, how is the safeguarding issues raised? And then secondly, the issue around staff training, what consideration has been given to continuing that in a virtual setting?
Okay. Thank you, Chair. Thank you for those comments, Councillor Hagar. Before I answer those two questions, just to clarify, the larger, the blue, are the number of concerns, and the orange is the number of inquiries, and we'll always have more concerns than inquiries. So 25% of our total number of safeguarding concerns progress to an inquiry, and what that means in real terms is something's raised, so there's a concern that somebody's being abused, neglected, or significantly self-neglecting, and we have conversation with the adult. We take into account a whole range of factors to decide if we need to make further inquiries and put plans in place to keep them safe. So 25% of that number progress to further work. This was an increase of 7% from the previous year, and I think that shows an increased scrutiny and around professional curiosity and actually listening to what the adult wants, because sometimes there's some really difficult conversations where the adult will say, I don't want you to do anything, and that's really difficult as a human being to walk away and think, oh, I'm uncomfortable, but actually, you know, within a whole lot of different caveats, they're able to make that decision. It doesn't mean we don't do anything, but it means at that time we won't progress. So in terms of COVID, so it has been particularly challenging, it goes without saying, and how fast-paced we had to make changes. And we made a decision with this joint report to clearly mention COVID and the impact of that, because that would be remiss otherwise. But because the report covers last financial year, really obviously up to the end of March, we deliberately didn't focus on the COVID period itself. So that sounds quite obvious to say, but I think it's important to outline that. We did not introduce any easements in adult social care. We still we were still able to contact any residents that needed support. We were still visiting where essential visits were required, taking the obvious risk assessments into account. The public were still able to contact us in all the ways that they always did before coronavirus, and continue to do so. So they can access the online form, they can call Hillingdon Social Care Direct, they can send us a letter, they can send us an email. We really aren't fussed. We'll take whatever they want to tell us in whatever format. And that continued throughout the period. So although staff were working remotely, there was still a presence in the office, and obviously that's increased. So we were able to respond timely to all concerns. So just to give the board that reassurance. In terms of training, so clearly there were and continue to be challenges around face-to-face training. And I think we would all recognise that there is nothing that can compare to sitting in a room together and bouncing ideas about and actually learning as a group. And it is difficult over Zoom and whatever else we're using these days. But the partnership have worked really, really hard to put back in place. So they've contacted providers that we commissioned to deliver training and asked them to alter that and to be able to do that virtually. We are revisiting e-learning, and again, that works for some stuff but doesn't for others. We also do have a number of very small within COVID restriction workshops that are ongoing, inward facing in the local authority. And in fact, there's a dolls workshop, I think it's tomorrow or Friday. So there are a number of different things happening. The partnership, our professional development forum, has developed some really strong guidance. And this ranges from 7-minute briefings, so people can pick it up and look at it quickly. It's not a heavy read for people. And we're just about to launch one around making safeguarding personal, for example. What is it? What does it actually mean? What does this mean for me as a practitioner? To wider, larger pieces of guidance and staff development. So we've tried to cover everything we can. I am confident that we've managed to successfully achieve that. It is important to note that a piece of work for this year is a multi-agency training matrix that the board will lead on, and this will cross children's and adults. And what we want to do is look at, for example, the intercollegiate documents that health use around training. So hospital staff will have X, Y, and Z that they must complete. Police will have different training, etc. And what we want to do in Hillingdon is have a much more coordinated approach to that, so that there's more quality assurance around what we're asking people to know about and what they do with that knowledge. And I think that's the sort of watch this space and a real ambitious development we want to move forward.
Thank you. Thank you very much, Claire. Councillor Eggington.
Thank you, Chair. I think I will echo what's already been said about the report being much more focused. Certainly the previous years, the reports have been full of errors, to be honest. So that's the good news. There is one typo, I think, on page 41 of the report, page 63 of the agenda, where we're actually talking about coronavirus, and it's got the middle of March 2019. I'm glad if we had been able to do some work in 2019, it would have been very impressive. Anyway, that's
Could I ask you to come to a question, please?
Pardon?
Could I ask you please to come to a question?
Yes, I'm going to come to a question. The question is that I see that there was a serious case review with child X, and I think it would be worthwhile all of us actually reading the report. It's online. It's a very worrying report, to be honest. It resulted eventually, and this is after 3 years, in the report, and there were 16 recommendations. Now, although on the website it gives details of the partnership's response to the report, it doesn't indicate in that response whether those 16 recommendations have been dealt with. And I wanted to, although some of them don't relate to the council, some of them relate to the police and other organisations, have they all been accepted, and are they being addressed, please?
Thank you for that one, Councillor Eglinton. That was one of the questions I had written down here myself. Who is responsible for ensuring recommendations from the serious case panels are implemented, and how is it ensured it's done in a timely manner? So I don't know which of you wish to answer that one. Maybe
Thank
Claire.
you, Chairman. Thank you, Chairman. I'll take that question. Being a serious case review was mainly focused around children. Services offered to children. Yes, the recommendation have been accepted when the review is published. So and the safeguarding partnership is monitoring the implementation of those recommendations. As you rightly said, they're not about, well, not just about children's services. It's a wider type. They're a wider recommendation. They're looking at some health sharing of information, and they're looking at the police communication. They're looking at social care. So all those recommendations have been taken into account, and we have a very coherent plan and very coherent tracking mechanism to make sure that the various partners who are involved in this recommendation and involved in this review are taking the necessary measure. As you would have seen from the report, the plan was to organize a learning event that was open to all the partners, and we had on our invite list confirm almost 200 people to attend. So it was a significant event, and we plan to do that event towards the end of March of this year. Unfortunately, due to the coronavirus and the kind of uncertainty around March time, what we've done, we put briefing out to people. So we brief everyone in terms of what the findings are, what the partnership response is, and what various actions are. So those actions are kept under constant review. And as you have seen from the report, the safeguarding responsibility under the new arrangements is equally shared by the local authority, by the CCG, and by colleagues from the police. And this is reflected in our executive leadership board, which is constituted by those three agencies who are holding the partnership to account in both achieving the outcomes, but also in things like addressing various recommendations from serious case reviews.
Thank you. Councillor Eglinton, has that answered your question?
Could I ask a supplementary, please?
Yes, please, go ahead.
It'd be brief.
Thank you.
I understand that London Borough of Hillingdon originally didn't consider this case to be would be requiring a serious case review. And it was only the police who insisted on it. Have you any thoughts about that, and how can that be avoided in the future? That we come to a situation where we have a case where there was a murder, a suicide, and somebody decided that it wasn't serious enough to actually have a review, and 16 recommendations come out of that, which are obviously very important.
Thank you, Councillor. It's difficult to go back to a specific case and to look through the details of what happened back at that time here in this forum. But I'm happy to look into that and get back to you. But what I would say in terms of the new arrangement, just to reassure you in terms of going forward and in terms of the future, part of the new national safeguarding arrangement has been introduced by Children and Social Work Act in 2017. The Act and the subsequent Working Together to Safeguard Children introduced the National Safeguarding Panel. So in that, the role of that panel is, as it says in the title, it's a national panel. But every time a significant incident happened in any local authority in the country where a child is significantly harmed, including a child dying, the local authority and the safeguarding partners will have to arrange within 15 days a rapid response meeting where they consider the situation of that particular incident, and that gets reported to the national safeguarding panel, which scrutinize that decision, and they either agree with the safeguarding partnership or they don't agree. And you will see in the report that is mentioned. And during this financial year, all the decisions that were made by the London London Borough of Hillingdon and the safeguarding partners, all of them have been endorsed by the National Safeguarding Panel, which gives us another layer of reassurance that we are making the right decisions and we're scrutinising ourselves.
Thank you very much, Alex. Can I now invite Councillor Mahwana, please?
Thank you, Chairman. My thanks again for such a comprehensive report. It's really detailed, so thank you for that. My question is referring to page 25 of the report under 5.2, looked after children. You mentioned that an area of focus is to ensure children's needs are met with regards to the Children's Strengths and Difficulties questionnaire. I wonder how will you ensure that these questionnaires are completed, please?
Thank you, Councillor. The strengths and difficulty questionnaire, as it says in the report, it's a very important indicator of children's welfare and how various services that we provide them and the engagement we have with them is actually making a difference in terms of their well-being, in terms of their welfare. So in terms of how we ensure that they are being done, we are approaching both. We are working very closely with our care providers, being those foster carers or being those residential units, and also with health colleagues who are undertaking for every child looked after initial health assessments or review health assessments, and through various interactions with the children, is decided who's the best person, who's the person that's closest to the child to undertake the assessment, and to make sure that is not always the social worker or always the foster carer, is the right person who needs to do that assessment. So through that we are focusing on that relationship-based practice again that I mentioned before with children, young people, with our carers and care providers, to make sure that the right person is applying the questionnaire. And you would see from the report that it's really encouraging to see that the score of the SDQs are going down. This is one of those indicators that, the lower the score, the better. So we are, the score continue to decrease and being 12.5 at the end of the year, which is almost 1 point reduction from the year before. But I would just want to also mention that if any of our looked after children score over 17, we automatically engage our MAPS service or CAMS service to make sure they are provided with assessment and with any support they might need.
Okay, thank you very much.
Thank you.
Any other colleagues wish to ask a question? I see no indication. If I may, then I would just like to ask one. Previously, it has been noted that the police weren't well engaged at the strategic level, and that's now been addressed. My question is, how do you reassure members that at the operational level, where there are many multi-agency meetings, that there is commitment and attendance at each and every meeting by the relevant parties? Is attendance monitored? Is it reported?
Thank you very much, Councillor. Absolutely, the attendance of police and health professionals to especially strategy meetings, and those are indeed many meetings where there are concerns about significant harm. That's been one of our priorities for the last 2 years, and that is indeed monitored. In order to improve the police attendance, just to focus on the police to start with, in order to improve the police attendance in our MASH, we are now co-located with the children investigation team from the police, the CATE team. So they are based together with our MASH colleagues, with the social workers, with health colleagues, and with independent domestic violence officers. So every time a strategy discussion is needed for a child, police are attending. Also, we have dedicated colleagues in the police who are ensuring that the right reports are provided for child protection conferences, and then the police representatives are attending child protection conferences. And we continue to keep a close eye on that, and we do have various scrutiny meetings and various forums in which the local authority and the police are meeting regularly. Some meetings are fortnightly, and some meetings are weekly, just to make sure that any issue that we identify, either way, either side of the argument, are get addressed immediately in a proportionate way. And I would just want to add to that, in terms of our colleagues from health, specifically the school nurses and the health visitors, who have a key role to play in strategy discussions, child protection conferences, and various other meetings. And I would just want to recognise that together with Children's Service and the police, they develop a new system by which they get notified when a strategy discussion is needed in real time, giving them sufficient time to gather the right information, to find the right person to attend that meeting, and for that person to attend the meeting. And I think the use of technology was a significant game changer in terms of professionals' attendance to meetings and in availability of people to quickly dial into a meeting onto a video conference, and that we continue to retain that going forward.
Thank you, Alex, for your answer. And just to show that we're not biased and just looking externally at our colleagues' attendance, can you assure me that there are 100% attendance from people like social workers, for example, at children in need meetings or case reviews or anything else? Is our attendance perfect, or do we monitor it even?
Yes, we do. And in terms of social workers' attendance, social workers, when you mention the child in need meetings, 9 out of 10 cases, the social worker will be the chair of that meeting, or they will co-chair with a young person, or other professionals will be chairing if they're closer to the family. So they are always attending. And child protection conferences, definitely the social workers, and quite a few cases, the manager of that social worker as well do attend or are invited to attend, and they have to both be present and also to provide either a verbal update or a report for that conference.
Thank you very much. If I may draw this item to a close with my thanks to both Alex for your attendance this evening and your presentations, for a thank you for the report, which is exceedingly full and very helpful in setting out the new arrangements. A lot of work needed to go in to describe exactly what's happening. I am so pleased to see references to the good performance that's going on by the partnership, not only recognised internally, that is always easy to blow one's own trumpet, but also the external recognition of the good work and the awards that have been granted. I am assured that we are taking fantastic steps to safeguard. As you say, we can always do more, and you can be assured that we will be working with you to ensure that we do our very, very best in this very important area. So thank you, and you may leave the meeting now if you wish. Thank you.
Thank you very much.
Thank you, Chairman. If, with your permission, I will stay for the next couple of items as well from the Children's Services perspective.
Of course you may stay. That's not a problem at all.
Thank you.
Chairman, sorry, can I just interject at this moment? Just to say that this report will be going to Cabinet later this year. So would the committee be agreeable to delegate to Democratic Services to work with the Chairman and the Labour lead to put together some comments based on this report from the POC, which will be reflecting the views and the discussion today? Is that all agreeable to all the members present?
Is that agreed, everybody? Yes. No dissenters. Thank you.
Thank you very much.
Thank you. We've now turned to the next agenda item, item 7, the annual complaints. Is Ian with us? Ian Anderson present?
Yes, I'm here, Councillor.
Good evening, Ian. Thank you very much for turning up. Thank you. Over to you then, please. Presentation on the agenda item 7. Thank you.
I think the focus of the meeting will obviously be on the volume of complaints that we have dealt with in some members' inquiries. But if I may, before I start the sort of saying some thoughts and suggestions and what's happened over the past year, is on page 102. There's actually a poem that's been written by a young lady, and it talks about the effect that councillors and members of staff have actually made on her life. And I think it's worth reiterating that how the impact that we actually have on people's lives and how important that is to them in terms of the various services that we provide. And this particular girl has actually expressed it, I think, very well. And I think we should take sort of great credit for the people involved in terms of what they've done, whether it's a member of staff or a councillor. We do provide these services to the whole various borough people within our borough, and they do appreciate what we can and are able to provide. So I thought I'd just draw that to your attention, because I think it's quite a nice little poem which says that. But going through the various information that I've provided in the report, just to take you through, I suppose, a quick canter, and then I'll be very happy to answer any questions that you've got. In terms of the complaint process, I provided you with a summary setting out the complaint position for last year and compared it with the year before that. Just by way of an aside, from not this coming financial year, what I will do is in next year's report, I will provide you with the data going back 5 years, so you can then compare it over a much longer period of time, whereas this report just focuses on the last 2 years. So going very quickly, the volume of informal complaints that the council dealt with in 2018-2019 was 2,756, and there's been a 15% decrease to 2,339. The number of stage 1 complaints overall has risen slightly by 3% from 837 to 861. The volume of stage 2 complaints overall has increased a small amount from 73 to 80. So a small increase, but I think that there is one point that I would like to make to you, is that the complaint procedure, the idea is that as it goes through the various steps, the volume of complaints should start to reduce, because the aim is to try and resolve it as they go through the various stages. The point to make about the stage 1 complaints is that there was a total of 861 stage 1 complaints, and the number of stage 2 complaints was 80. So statistically, it's suggesting that 91% of complaints are being resolved between stage 1 and stage 2. So the process is doing what it's designed to do, I suppose. There were no stage 3 complaints. In terms of the number of complaints that were dealt with by the Ombudsman, there was a significant drop from 86 for 2018-19 to 59 for 2019-20. No particular reason why that arisen. I can't say that COVID has had an impact on that, because the financial period is from the 1st of April 2019 to the 31st of March 2020, which just covers a little bit of the early part of COVID. So I can't say that that's had a dramatic impact in terms of the volume of complaints reducing. The number of compliments has risen from 234 to 301. And I can tell you from the figures that I'm looking at for the first 6 months of this year, there's been a massive increase in the volume of compliments that we've received. And I'm probably predicting that there will be in excess of 600 when I come to do this report next year. The area that's received the most number of compliments is actually people complimenting the council about wildflowers across the borough. And it's had a massive impact. You wouldn't believe the number of, I think I've had nearly 65 compliments alone just on that one area. People saying how lovely to see these wildflowers. I'm told they're perennials, so we'll see them again next year and year after year. So that's had I think it's had an uplifting effect, really, I suppose, on people, particularly during this difficult time. The volume of members' inquiries has dropped slightly from 11,308 for 2018-19 to 11,047. So a small drop in terms of members' inquiries. Just to give you some breakdown in terms of members' inquiries, that one area of members' inquiries dwarfs everyone else, and that's waste services. Waste services last year received 5,949 inquiries. Antisocial behaviour was the next highest, and they received 1,408. Housing, 1,311. And the rest of inquiries were fairly small in terms of the number of inquiries coming, and that includes planning, includes housing. So the volume of members' inquiries lies pretty much in the waste services. That's where the general volume is. In terms of members' inquiries for the children's services and adult social care, they're very small in terms of the number of inquiries that we get from members. But what I would say, and I guess I've said it in previous years, is that to deal with the members' inquiries for children's services or adults is much more difficult to deal with as is a complaint, than it is about waste services. Waste services generally is someone saying, there's fly tipping going on, can you sort it out? Generally, the answer is fairly easy to deal with. Whereas someone might well be saying, there's something going on with a children's home, or there's something going on in terms of a family, that's much more difficult to deal with. We also sometimes get cases where there are ongoing litigation, and there's also a complaint, and there's a members' inquiry at the same time. The council has to be so careful in terms of what it says, so that we don't prejudice the ongoing proceedings that's going on in terms of that. So it's in terms of the complaint process, members' inquiries, the compliments, it's kind of like just progressing in the same way as we have in previous years. There's not anything that I would say to you that I'm particularly concerned with. There are some things that I think we need to work on, and one of the things that I'm always a bit concerned with is the timeliness of responses. One of the things that our residents don't like, and I guess a member as well, is if we say we're going to respond in 10 days and it takes us 20 days to respond, that isn't good. The impact is it has a habit of making things worse.
Ian, you've frozen. Colleagues, let us just hang on for a couple of seconds. Ian Anderson looks as though we've broken the link to him. His connection's gone down. Let's see if we can regain that. Liz, are you able to contact Ian and let him know of our difficulties and ask him to rejoin us?
I can certainly try. I can try his number, but I think he may be at home. I think he may be about to try and rejoin, possibly, which might hopefully rectify the problem. Let's wait a moment. Here he comes now.
Excellent, thank you.
You're on mute, Ian.
I'm so sorry. It must be at my end. It's one of the vagaries of, I suppose, virtual. Just to say, so what I was talking about earlier on is in terms of the timeliness of responses. It's really important that we do respond to inquiries on time, whether it's a complaint or a members' inquiries, freedom of information, any of those things. And it is an area that, in particular, one area that I'm slightly concerned with, and there are plans that have already been put in place. So in terms of the timeliness of responses, the finance cert area, for example, of the 213 complaints that was responded to, 210 were responded to within time. That was 99%, which is pretty exceptional, really. Adult social care, 42 out of 45 inquiries. That's 93% was responded to within time. Children's services, 73 out of 85, 86% was responded to on time. And again, that's to me, that's reasonable in the sense that literally 9 out of 10 of inquiries are being responded to on time. In terms of resident services, this is the big area really. Includes housing, planning, antisocial behaviour, waste services. So there's a whole range of services in there. 372 out of 518 complaints were responded to on time. That's 72%, which is a drop from the year before of 85%. So it's an area that I'm working with some teams because I've been able to highlight in which services that there has been a depreciation of performance. Some of the reasons for that is because it's taken longer to resolve things. So, for example, in terms of the antisocial behaviour, some of their investigations have taken them beyond the 10 working days, so they've missed the target, and it's taken longer. In terms of the repairs, some of the repairs in terms of getting people to have a look at a property, seeing what needs to be done, doing the actual completion of the work has taken longer than I'd envisaged. So it's those type of things that needs to be. But overall, in terms of the actual performance, in terms of adult social care, children's services, generally good performance. in terms of timeliness of responses. I'm very happy to take any questions, or I'm very happy to cover anything else that you want. Or
Thank you, Ian. If I'll come in at this point and just say, I really appreciate the amount of detail that you've included in your report. As always, they are very thorough, fantastic detail in terms of the numbers, the transparency with which this council is prepared to scrutinise itself with regards to complaints is fantastic. But I'm also pleased that you properly introduced this item with compliments to show that actually this isn't just about looking at the wrong, this is looking at performance, and that you appropriately draw the right balance and draw attention to the very good work that is commented on and commended by our residents. So I'm grateful and thank you for that. Colleagues, do you have any questions at all that you wish to ask? Councillor Haggar?
Thank you, Chair. I'd just like to say it's a good report again. I mean, each time we're seeing these reports coming in, we're getting some really good figures and good response rate. Well, I did really like when I was reading this report, actually, that we are so honest with our reports as well. And I think that is very important. I just like to make that noted. And as I've gone down and read them, especially the ones that are upheld, where we've realised we haven't come in time and we've apologised, and even actually in some cases given a monetary, amount to say we're sorry. And I just really wanted to highlight that, Chair, in the report, because I think it's really important that we are seeing, complaints are coming in, but we are actually acknowledging it and then doing something about it. And that's what this is about. That really is. So congratulations, Ian, because each time you bring the report in, it's just really good. And we're getting so many compliments now from it as well. So brilliant work. Thank you, Chair.
Thank you, Councillor Haggar. Well put. Are there any other observations, comments or questions? Ian, if I may just ask one, and that's whether or not you believe there is the ratio between stage 1, stage 2 and potentially the Ombudsman. Does that tell us anything, or is that completely random?
It is random, I'm afraid. It's the only conclusion you can draw on is that, for example, there was 861 stage 1 complaints and there were 80 stage 2 complaints. The only thing you can draw from that is that there's certainly been what you can draw is that the complaint process is doing what it's designed to do, in that as it goes through the different stages, it reduces in numbers. What you can't say is whether the person who complained at stage 1, the reason why they complained, they didn't go on to stage 2 is that they were totally satisfied with our response. You can't say that because I don't know that. What you can draw on is that if they were dissatisfied, they would almost certainly ask to go to stage 2. So from that you can infer that there is a level of resolving the complaint to the person's satisfaction, so that they don't progress to the next step. I think that's probably all you can draw from that. I would say.
Sorry, keep muting and unmuting ourselves. Is there anything we can draw though from the ratio between stage 2 and the Ombudsman upholding or partially upholding? Is this some comment about the completeness with which we conduct our stage 2? Is that an error rate? Is that saying actually you got it wrong and you should have found in favour at stage 2 and should have ended it there? I mean, what is it saying to me?
Yeah, the first thing I would say to you is it's very difficult to draw a conclusion from the Ombudsman, their findings from the actual stage 2 or stage 3 findings. The only reason I say that is because it takes the Ombudsman a very long time to conclude an investigation. So some of the Ombudsman decisions there go back 18 months. So it's because it takes them so long to do that. The actual complaint that was complained of in the year that it was complained of is reported in the following year. So it's very difficult to draw that conclusion as to. But what you can say is that we do take the Ombudsman's findings really seriously. And I can see that I've got Kate and Alex and Claire somewhere as well. And when we get a report where there is a finding of fault in some way, I know Kate and Alex will always come back and say, look, what's gone wrong here? What needs to happen? And there are often meetings that take place between either Kate and myself and Alex or whoever to try and see what can we do to sort it out and B, so it doesn't happen again. And it's that seriousness that we do take these complaints. There are some complaints where actually we actually believe that we're right, but the Ombudsman feel that we've actually got it wrong. And there have been some where we actually believe that we've actually applied our policy carefully. And it comes to a point where do you argue with the Ombudsman, or do you just say, well, actually, okay, they've made a point, we've got a point, let's just try and move on. And I think sometimes we take a more sort of practical approach and accept it and move on. And I think I would say the Ombudsman and the council have a pretty good relationship in terms of the way we work together. And what the Ombudsman can do is, if they're really unhappy with the way a council operates, if they can publish a public report, which then is in the public domain, and it sort of says, X council has done this and we're not really happy, we told them to do this. We've been quite fortunate in the way we've dealt with the Ombudsman and the way we've accepted their recommendations, or we've challenged it in the right way, I think. So there's quite a good relationship from my perspective anyway there. But also, you've got Kate and Alex and a few others, and they are absolutely committed to making sure that whatever their service is, it provides the best that they can, and to make sure that whatever we've got wrong, we put right so it doesn't happen again.
Excellent. Thank you, and thank you for explaining that lag. That makes an awful lot of sense, and I will now be able to interpret these reports accordingly. And the one thing that does come across is not only yours, but the council's openness, as Councillor Hagger pointed out, the openness and the way we confront complaints and deal with them, and our willingness to learn. And it isn't the case that we've just reported numbers. We've gone into some detail here about how things have been found against us in circumstances and what we have done about that. Our willingness to learn is the important bit here. And I thank you for your stewardship of this and the completeness with which you presented and provided this paper today. Most helpful, so thank you, Ian. If there's no other comments to be made, I thank Ian very much and allow him to get away from us, and we will move over to agenda item 8, making the council more autism friendly. Okay, Liz, is this something that you wish to comment on? I mean, we have had a break from the COVID. It has set my thinking back a little bit with regards to autism. It is important that we get back on top of this one. It is about restarting, I think, the inquiry following a short session. And what I understand is that you are presenting the papers that we've already seen to say, effectively, let's start again, guys, let's go again, let's pick this up. Am I correct here, Liz?
Yes, Chairman, I think that is correct. So we have updated the scoping report, and obviously the timings have had to be revised due to the whole COVID-19 situation. So I've included in there the minutes of the site visits that were undertaken earlier in the year. So I think it is now just a case of trying to pick up from where we left off, which is to some extent starting from scratch, I suppose. So yes, I did send around a link to some online training, which I think members were hopefully able to access in relation to autism, just to get some kind of training and some background knowledge. I don't know, I haven't actually heard anything back from members to say that they weren't able to access it. So I'm hoping everyone's completed that training. I can see some people are nodding. So there's that side of it. And obviously, I don't know if members feel that further training would be useful or would be required, perhaps. I know we have officers who would be willing to conduct a training session if that's what's requested by the councillors on the committee. So that's one option. And then in terms of the next steps, if you have a look at the work programme on page 117, you can see on there that we have a couple more sessions witness sessions lined up, one for the October meeting, which is looking at children's services, transitions, preparation for adulthood. And then the following session is on the 26th of November, which will be looking at the wider council services. So I'd be interested to know if members have any comments, if they have any suggestions, perhaps witnesses that we might want to invite. I can see Councillor Gardner is indicating. Because at the moment, obviously I picked this up from my colleague who initiated this with you. So we have somebody from the parent carer group who's due to attend in October. We also have Poppy Reddy attending and presenting a report on children's services and transitions and preparation for adulthood. And then following that, we have the wider council services meeting in November, which will be attended by the Hillingdon Autistic Care and Support Service. A member of that will be attending, and we're also planning to conduct a survey, I believe, of council services to look at frontline services and how autism friendly they are. So that's sort of the outline that we've got at the moment, but obviously I'm very happy to hear what people think about it and if there's anything that we could improve on or any comments. So perhaps I could hand back to you, Chairman, and I know Councillor Gardner wanted to raise something. Thank you.
Thank you, Liz. Let's invite Councillor Gardner now, please. Councillor Gardner.
Hi. I'd like, if possible, to have a witness session or a section of witness session. Somebody from the benefits agents attend, because it would appear that there's some people with children with autism get benefits, others don't get benefits. It's a very strange system. I mean, I've got evidence, but I'll privately share that with the members here. But it's almost like sort of, I don't know. It's very bizarre. And I'm dealing with several mums who've got children with autism from the variety of the spectrum, starting from very low to heavy duty. And I just wonder, I'm trying to work out how we could get the benefits agency on board with. I have heard that apparently some woman said to a mum who tried to ask for PIP, I think it was said it's probably all in his mind. Is talking about his child who had who actually had a diagnosis of autism, and it was halfway along the spectrum. So he was. I'm trying to think of a polite way of saying it. No, he was clearly not very well. Let's put it like that. I think that if we could somehow just get somebody from the benefits agency.
Thank you for that, Councillor Gardner. So we're looking at the witness session 3. This will be one on the other services. Liz, this is something that we would like, please, to have an understanding of how autism friendly the access to benefits is, really. And that is something that we'd invite you to shape up. Councillor Hagar, you indicated that you wish to speak.
Thank you, Chair. Yes, I just wondered whether there's any possibility that we could put, I mean, I don't know whether there is anywhere either that does this, a charity that does adult autism, and we can link that in and speak to someone, because I know that in Hillingdon we've got quite a few of the children autism, because we've got Hacks and we've got Eastcote Autism Centre, but I'm not actually, I mean, I might be wrong, I'm not actually aware of any adult ones, and I think that would be really preferable, because I think that's what we were looking at. We're missing the adult autism as well in all this. And I'd like to see what places are friendly around the Borough of Hillingdon. I know that's what you said earlier on, but actually what's friendly in the terms of shops, news agents, Tesco's, and they have like little notices saying we're autism friendly for adults. I think that would really be really good for the borough, because it's something that we can do. So I sort of like to have a little bit more looking into that, Chair, if possible.
Thank you. I've noted that one, and that is something that I'll have a discussion with Democratic Services about. It may be that looking at the issues that we wish to cover, we might need to have an additional witness session, and we may need to adjust the programme accordingly. That's fine. I have no issue with that. But whilst we have Alex here, I'll come to you in a second, Councillor Eggington. if I may, while we have Alex here, can we use this time to guide him of the sorts of areas of inquiry that we are likely to be making at that session on the 21st of October, so that he comes best prepared with the information that we need? Can we give him a heads up of the areas that we're likely to be looking at?
Thank you, Chair. That's appreciated.
Thank you. Councillor Egginton, do you wish to come in?
Yes, just a bit of information. The notes on the visit to the Centre for ADHD and Autism Support, actually you'll see that they do cover help for adults as well in that. And when we went, they did talk about a much wider, they don't just deal with children, it's the all ages. So there is that support already there. Although obviously it's mainly financed by Harrow, so they concentrate more on Harrow, I think, than Hillingdon.
Okay, Alex, if I may guide you, I think one of my thoughts around the autism friendly will be understanding from the parents whether or not they believe that we are receptive to the issues that they are seeking help on. So whether we understand them, whether we're approachable on them. And then for the children that are slightly older and able to represent their own views, how do we ensure that we are listening to them? What opportunity do we give to listen to them? And how maybe do we deal with potential conflict between what they might want, what their parents might want, recognizing that autism is an additional complication within that factor? You know.
And I would probably add something in there, Chair, because obviously sometimes for some of our children, we are the corporate parents as well.
Absolutely. And
so so we have to exercise our parenting role as well.
Excellent. Thank you very much. That's good. Okay. Anybody else wish to come in at all? I see no other indications. So I would take it that that is complete agenda item 8. I hope we've given you a little bit of a head up, Alex, of where we're likely to be asking and investigating when we see colleagues, either yourself and colleagues, on the 21st of October.
Thank you. That's much appreciated. Thank
you. I'm grateful. You may continue to remain with us if you wish. Agenda item 9, the corporate parenting panel. The notes of the meeting held on the 19th of March. Are they all noted, colleagues? Are there any issues that anybody wishes to draw from those?
Chairman, if I may just draw the committee's attention to point 33, item 5, which is on page 126 of your agenda pack. There's just something that the committee need to agree. So it's at point 5, suggested to the Parent Policy Overview Committee that the membership of the Corporate Parenting Panel be increased to include a senior officer from Children's Services. So can we just ask the panel if they're, if the committee are happy to agree that?
Okay, colleagues, we're being asked to agree at the bottom of page 125 and over onto 126, those 5 points. Does anybody dissent from agreement? I see no indication. I've had nothing come up on the screen, so that is taken as agreed by the panel, those changes. Okay. Turning to agenda item 10, which is the Social Care, Housing and Public Health Forward Plan. Is that noted, colleagues? And are there issues that you believe we should be considering? I will push it in the mix here that Cabinet have or will tomorrow look at the COVID-19 local control outbreak control plan. I believe this is a very significant public health issue. And I think it would be remiss of us if we didn't actually exercise our scrutiny of this and just consider what it's saying and dive into it a little bit more detail. I'm confident that it will be complete, but I do believe that we should be carrying out that function. And so I would like to include that within our next meeting, if that were possible. If Democratic Services felt that that would be too congested, then we might hold a special meeting to review that paper on COVID-19 and allow members opportunity to ask officers questions on such an important issue. Okay, that's noted. And Liz, is that okay? Can we do our best to get it within one session? If the judgment is that this will take too long, then we may need to set up a separate one. But that is something that I will discuss with you and the Labour lead outside of that meeting, if that's okay with everybody. Okay?
Yes, that's fine, Chairman.
Thank you. Is there anything else within the forward plan to be noted and commented on? No, I see nothing. I have no indications in the chat. So that takes that one complete. We now go to agenda item 11, which is our work plan. And that is just to note, these are the dates and times of the meetings. Let it be read that it will be virtual until you're told otherwise. Okay. My expectation is that will take us probably through to the rest of this year, the virtual ones. Let's hope I'm wrong in that. Let's hope it is resolved a bit earlier than that one. Any observations, comments? No? Sorry, was that an indication, Tony, or were you turning a page? I just saw a hand raise. Thank you, turning a page. Okay, colleagues, that takes us to the end of the agenda. That being complete, the meeting is now closed. And thank you very much for your kind attention this evening.
Thank you.
Good night, everybody.
Thank you, colleagues. If you could all just remain on mute just while I stop the stream, please. That would be much appreciated. Thank you.
Thank you. Good night.